The US has one of the worst healthcare systems in the world. It spends twice as much as comparable countries, but it has worse care, more deaths, and many people go bankrupt. If you break a leg in the US and you don't have healthcare insurance, you might pay $7,500. Having a baby costs around $13,000, and cancer care can go into hundreds of thousands of dollars, versus zero with the NHS in the UK. This is a system that we want to avoid like the plague, yet our politicians seem to be wanting to make us more and more like America. How do we stop them? Welcome everyone, this is We Own It Live and my name's Kat. We campaign for public ownership. We're here with you because we believe in public services for people, not profit, and we want to do something about it. Thank you so much for being here today. Please do put your comments and questions in the chat and we'll get to them during the Q&A. So to kick us off this week, we've got a video of the action that we did at Labour Party conference on Monday. Many of you were involved in this or supported it by writing to the leader of the Labour Party, Keir Starmer. So we'll kick off with that video now.
But would Labour be selling out to rely on private investment? This Oxfordshire pressure group argues the NHS shouldn't take private money.
Labour could be telling a very straightforward story that we don't want shareholders profiting, we don't want US companies running our health services. It doesn't work, it's failed patients, and we need to actually invest in, trust in, build on our NHS as it was intended to be.
So you might have noticed Keir Starmer coming up behind me while I was talking to the media. Keir Starmer was actually Dr. Andrew Meyerson, who is an A&E doctor and a campaigner for the NHS with Health Workers Say No, and he's also part of the SOS NHS Coalition. Welcome, Andrew. Lovely to have you here.
It's great to be here. Thank you so much for hosting this event and for the amazing action at the Labour Party conference a couple of days ago. I was so proud to participate in that.
Thank you for being part of it. I think you were the best possible Keir Starmer we could have had because you were kind of, full of energy and really highlighting the choice that Starmer has to make on the NHS. So there was a lot of energy in your performance. I think you've got a possible other career as an actor if you moved away from NHS campaigning and being an A&E doctor. So tell us a bit about you and how you got involved in this and a bit about your background.
Yeah, so if you can tell from my American accent, I'm originally from Baltimore, Maryland, just near DC. And if you don't, most people in the UK know either Hairspray or The Wire, as where I come from. Also, if you're a baseball follower, most people aren't. Our baseball team just did pretty well, but then got knocked out in the playoffs. It's an American city, former industrial city. And I grew up there. My dad was a doctor, moved there to work at a major hospital there, Johns Hopkins. And I grew up in a healthcare family. My family's originally from, back in the day, long before I was in the picture, it's sort of like the founding story of healthcare in our family is that my grandmother, for whom my sister is named, had a stroke. Catastrophic one, while her children, my father, who was in late teens, and his brothers and sisters who were in their very early teens, the family struggled to find a healthcare professional, a doctor down the street. I think they ran towards, nobody would come to help, an ambulance wouldn't come, and she passed away. And the helplessness that the family felt as teenagers, it destroyed them. But it was a moment that I think spurred my father to become a doctor. And then and all of his brothers and sisters went into healthcare as well. And so my dad's a doctor. My mother is a speech pathologist. My aunt was a matron in Boston. My uncle was a burns nurse in San Francisco. My other uncle ran a radiology department in New York and Connecticut. And my sister is a rabbi and also runs a palliative care department. My brother was an EMT. And I never wanted to be in healthcare. Actually, the working on the Israeli-Palestinian conflict was what I actually did first, as it turns out, and just horrible what's happening right now. But I decided after doing that to go into healthcare, and went to New York for first couple of years of training, and then came over to the UK about 8 years ago. And just growing up and seeing what healthcare and the delivery of it is like in the States, and seeing so many friends and family who have had their financial lives destroyed by terrible healthcare bills, among some of the ones that you had mentioned previously. And we can play a game later with guess how much American healthcare costs. I just looked at some updated statistics, and it's not pretty. And just seeing the financial strain that puts on people, forcing over 500,000 Americans every year to declare bankruptcy. It's a terrible way to deliver healthcare. It's a barbaric way to deliver healthcare. It's not like the United States doesn't have plenty of money to fix this, but there are people who have no interest in wanting to fix the system because it is a cash cow. Nearly 20% of the American economy is healthcare, and a lot of that cost is borne by is on the shoulders of patients that come into A&E that need treatment, that need life-saving care. Oftentimes they don't have insurance, and they will have to pay out of pocket, or set up a GoFundMe page to rely on the generosity of strangers on the internet. Or borrow from friends and family, sell their house, sell everything that they own, go into deep, deep debt because of this. And in the wealthiest country in the world, I just think that that's awful. And it's just a terrible way to deliver healthcare. So you can understand why I love the NHS, right?
Absolutely, yes. And that was a very moving story you told about your family. And I guess, did you come to the UK? Kind of, was it sort of life circumstances, or were you wanting to work in the NHS, or how did that come about?
So I had finished the prerequisites for medical school in the United States, and I had my application and everything ready to go for to the US, to a school in the US. But that you apply to apply to medical schools everywhere around the United States. So you could be sent to I could have stayed in New York. I could have gone to Washington. I could have gone to rural anywhere in the States. My partner also wanted to study law, and so we ended up hearing about a great program at St. George's in South London, and decided, oh, London sounds like a great place to study. And when I came here, it was in learning about the NHS and what you guys had. 10 years ago, the NHS was ranked the #1 healthcare system on the planet.
Yeah.
And I was like, shut up. That can't be right.
Yeah.
But it was, this is a socialist healthcare system that you guys founded 75 years ago in the aftermath of World War II it's not a crazy thing. You use your tax money to fund the system. It's the cheapest way to deliver the highest quality healthcare. And as soon as you bring the private sector in, it wastes a hell of a lot of money.
Yeah.
And so, I fell in love with the NHS. And then over the last 8 years, finishing med school and then going to training, and then, and then through the pandemic, I've just seen the quality of the system, the quality of care that we're able to deliver to our patients just fall dramatically. And every year this gets worse. Every year there's a worsening winter crisis that becomes, that just becomes earlier in October and September, and then we see spikes in the middle of the summer, times when we should not be expecting to see the numbers and the burden, the stress that we are experiencing in A&E. And it's just getting worse and worse. And there are a number of reasons for that we can go into, but it's just, it's so sad coming from the worst, healthcare system in the developed world, place where, people come to serious harm because of terrible policy failures. And then coming over here where the design of it was perfect and the funding of it was excellent for quite some time until austerity, until underfunding, until a government that has basically abandoned public health in this country. And so that's why I'm just so why I'm such a fierce advocate for the NHS, and why I believe in it so much, because nothing can beat it when we fund it well and when we treat it well.
Yeah, and you do an amazing job of that. I think there's something really clear-sighted about how you talk about this, and I guess your perspective of seeing the US system at close hand, and then seeing our system when it was doing well in 2012, and then the degradation over the past 10, 11 years. And you tell that story really well and so strongly, both in the media and on social media. And if people haven't seen or haven't come across Dr. Meyerson before, do check him out on Twitter, because he repeatedly tells us, dear UK, this is what you have, this is what you stand to lose. And he just sends that message again and again and again, really, really powerfully. And that's why we really wanted to get him on the channel today, so that you could ask your questions and sort of hear his perspective. So just
thanks so much for having me. Yeah.
Tell us a bit about how the US medical system works, and then we'll have some quotes as well in a moment with some of the key stats, but maybe just a very brief overview.
Okay. So historically, and this is really around the time of around World War II, when there was a in the aftermath of the financial crash of the Great Depression, 1929, and the period of the 30s, you saw increasing numbers of people going into really terrible extreme poverty, and by the early 1940s. There was a government push to finance the creation of hospitals to be able to deliver care, to subsidize care for poor people, to ensure that they had some level of healthcare. And but the dominant force in American healthcare has always been you get a job and you get a healthcare package associated with that. Mm-hmm. And you can, so when you're signing up for a job, you go to Human Resources and they say, well, you want the platinum package, the gold package, the silver package, or the basic level of care. Or for a while, you could just say, I don't want any health insurance. If I just want to say, I don't want that. And
then you want to have some savings, I guess.
What do you say?
If you say you don't want any health insurance, you probably want to have considerable savings in the bank in case anything goes wrong.
Or a lot of younger people. A lot of younger people, or people think that, I just don't need it, or I'm not going to use it, or, for whatever reason. I can't, people that think, I can't afford it anyway, even if I have it. Mm-hmm. And so there's no point in me trying to pay for it if I'm not going to get much in return. And that's been the dominant force in the delivery of American healthcare. That's why, it makes no sense to me about that. So, if you have somebody that's in a terrible job, and they will stay there for years because of just the healthcare package, and that's it. Mm-hmm. And it prevents people from going off and becoming entrepreneurs, prevents artists from going, to doing, whatever they want. But the biggest thing is that it doesn't work. It's a waste of money. It leaves far too many people out of the system. And so in the late 60s, there was a push to create. So we basically have so most people access their health insurance through their employer, and they pay a lot of money to get the really good package. They pay nothing to get barely anything, and so. But then a lot of other people are covered through Medicaid, which is a healthcare policy funded by the government and states to be able to give healthcare to poor people. And that's, so if you are at 100, I think it's 138% of the poverty line, whatever the government defines that as, then you can access this care. Oftentimes it is substandard care. It is it's through providers that are not paid, that don't pay their staff terribly well, and so they can't attract a whole lot of staff. Imagine 20 years from now if the government policies in the UK were to continue, where you really have a solid two-tier system, where the wealthy people access everything that they want, and then the poor people access an underfunded, under-resourced NHS. That's basically what they would have as Medicaid. And then people over 65 and some other people will get government-sponsored healthcare for people who are elderly. But the whole system is a mess. It is far too complex, and that's one of the reasons why it's been so difficult to fix, because of the complexity of it, because of the insurance companies that fund massive amounts of lobbying into the system. But you have, that we're left with a system where 30 million people have no health insurance at all. where something like 50 million people are underinsured. So you get you have an accident, a catastrophic accident, and you need to get care. Then the insurance company will say, well, okay, well, you're on the hook for the first $10,000 of this bill, and
Wow.
then we'll kick in what we pay for it. But then they'll also argue with you about these bills. They'll also deny it. They also have, they'll also, oftentimes you're required to, to spend far too much time arguing with insurance companies. You have healthcare providers who have to argue with insurance providers because they want to deliver the evidence-based care that they know works the best. But the insurance company said, well, they're not covered for that. And so patients are repeatedly denied access to care. And so it's a disgusting system. It's an awful system. And, seeing both patients that have been harmed by it financially and also physically, and then also seeing just the enormous waste in the system. It is a waste of taxpayer money, the way that healthcare is delivered in the United States. But the companies that deliver that, they want to be able to continue to rake in massive profits, and that's what patients are fighting for, and fighting against. And there are multiple iterations of trying to fix this over the years. From when Hillary Clinton had the brief during President Bill Clinton's presidency, they called it Hillary Care. They said it was a socialist takeover of healthcare. The same thing with Obamacare, and so the fight continues. I hope in another generation we have a Medicare for all. That's what a lot of people are fighting for. But it is a terrible fight, and it's a fight that you guys do not want to have, because once you lose it, it is desperately difficult to claw back.
And did Obamacare, has it helped at all?
Yeah, so it's lowered the rate of people who are uninsured. It ensured that there was these terrible policies that that insurance companies would frequently just kick people off of their health insurance, and it reformed a lot of those laws. It meant that a woman would be charged equally for health insurance to a man. Historically, they said, women cost more to deliver health care. They have babies and stuff. It's a lot more expensive, and so we have to charge them more, and that's wrong. And deeply, and so it's fixed a couple of things, but we still have 27 million people who have no health insurance at all.
Wow.
And and the Republicans have fought tooth and nail in the courts in states to prevent a lot of the beneficial new structures that would have been implemented from taking place. And so patients continue to be harmed, especially in Republican, red states, we call them. And and so you see the from my own personal family, the experience that we went through, and also just seeing my country and how it has how healthcare has evolved there. It's a nightmare. And so that's why I absolutely love the NHS and fight for it.
Yeah. And as you describe it, it just sounds to me so scary and stressful, as just something, depending what age you are, how healthy you are, but it's in the back, either in the backdrop of your life or more in the forefront. But you're always aware that something might happen and you're not prepared for it. I fell and broke a bone in my arm, fell off my bike back in February. I might have been one of those people who thought, I'm not going to need health insurance. But actually, I would have done if I'd been in America. In the UK, I didn't have to pay anything, and now I'm fine.
And that would have cost, something like $3,000 to $4,000, in the States.
It's completely crazy, and what that does to people's mental health as well, of just being aware of that, and like you say, not wanting to maybe do jobs where the package isn't so good.
Right.
The right talks a lot about freedom, but actually, the NHS gives all of us a huge amount of freedom in our lives to not have to worry about our health. That's just huge.
And it's better for employers too to not have to worry about this.
Right.
It is a simple, functioning, great system. And when we talk about it, when we talk about loving it, it is because the data, tells us that this was the number one ranked healthcare system in the world for good reason.
Yeah.
You save money, deliver excellent healthcare. It's good for everybody, from the individual to employers to the government. It's just, if you want to waste money, go private. If you don't, then fund the NHS.
Yeah.
Really simple.
completely.
Yeah.
So let's just have a few quotes now. And we might leave off the last one because that might have been pre-Obamacare, but I wanted to just highlight this from Dr. Alison Pollock, who of course wrote the NHS reinstatement bill and has done lots of really important work highlighting what is needed in our NHS and how we're moving in the wrong direction. We meant to spell marketized with an S, because it's a little bit ironic otherwise. But yeah, so before anyone comments on that in the chat, but yeah, it's scary that we're moving more in that direction, kind of by the back door and in lots of different ways. But not least because with people on waiting lists, a lot of people are being forced to go private and therefore thinking about health insurance. Yeah. And then I think we've got some other quotes about the American system, just some really shocking stats. So, stats about the debt and how many people are facing debt. And, as we've been saying, the ways that stops people in America from doing other things in their lives, like getting on the housing ladder or having a child, because that's in the back of their minds. And they're, or they literally have huge amounts of debt and they're trying to pay it off. If we move on to the next one. So yeah, this was pretty shocking to me. 62% of all bankruptcies, medical, that was in 2007. I don't know how much that has changed, probably a bit. Also interesting, a lot of those people, middle-class people even, and they had health insurance. So, you presume from that the insurance didn't cover them because of the kinds of complexities that you're highlighting, where they sort of dodge responsibility. And moving on to the next one. Yeah, also we haven't touched on this yet, but the fact, me and John Bosco talked about this in a previous YouTube live, the way that in the US, a lot of the operations that are done are actually unnecessary. And doctors are incentivized in the wrong way, incentivized to carry out operations where they're not actually needed, which is pretty scary stuff. Yeah,
it really is. Yeah. It's awful. I mean, you look at, I think there's a couple of weeks ago, there was a report that said that, like 900,000 to 1 million people in the UK in the last year had had used private healthcare because, and I don't blame any of them. I really, really don't. If you are waiting on this longest waiting list in NHS history, it's now 7.7 million people long, the longest in history. It is a terrible indictment of the management of public health in this country over the last 13 years. This government has done a terrible job, and they are, the way I look at it is that this government is holding the public hostage, trying to build up this private healthcare system because they do not like the NHS, and that's been proven historically from their writings, from their policy, everything. They want to transition us to an American-style healthcare because they think it's good for the economy, and that's all that they care about because they don't access the NHS. They go private themselves, and upwards of 1 million people accessed private healthcare in this country last year because they are being held hostage by this government that refuses to invest in it, refuses to care about it, refuses to fix all the policy problems that we have, and it's horrific seeing the consequences of that on a daily basis, and 10 years ago, how long did it take you to see your GP? About 24 to 48 hours. Now it's taking like 2 weeks. 10 years ago, you could go into A&E and be seen in under 4 hours, and now it's taking 24 hours in A&E is no longer just a television show. It's a reality for far too many people, and cancer care. 10 years ago, you would be on, the 2-week wait list. So, when you come to see your GP, you come to A&E, and we see something that we're a little bit concerned about, then we say, well, we need to act on this very quickly because, time saves lives. And you can imagine a patient that is just so fearful once we tell them that, and it's understandable that they're fearful, but we have to act quickly. And if we don't act quickly, then their life can be put in danger. And we have so many patients now over the last number of years who have come to harm because of these delays accessing treatment. I think something like 120,000 people died last year on the waiting list, waiting for care. And so it's horrific. It's terribly scary. And so, they are, holding everybody hostage, forcing people into private healthcare. And you see the private healthcare market in this country is just booming. You see ads for this on social media, ads on television. And if you look at these ads, I want everybody to look at these ads. And if you look at the bottom of the screen, it will always say, that we don't cover pre-existing conditions.
Right.
And that's been the thing for American healthcare for years. They will not cover pre-existing conditions. And so if you have any sort of chronic illness, anything stemming from that, then they won't cover you because it is not in their financial interest to do so. That's why the delivery of healthcare needs to be, a system like the NHS, where it is evidence-based, where it is government-funded, where and it's not free. It costs a lot of money, but it comes out of your taxes, and that's the right way to do it.
Yeah.
But we desperately need a government that cares about it, that cares about public health. And you look at the legislative mechanisms that this government's used over the last decade to put this in place. From the 2012 Health and Social Care Act to the 2022 one, they have deeply entrenched this two-tier public-private partnership type thing, which sounds lovely, but it ends up hurting patients in record numbers, and then pulls so much money, so much funding out of the public system that should be used to care for patients and treat them, and reduce these waiting lists, and fund more doctors and fund more hospital beds and fund urgent infrastructure upgrades. But because they refuse to invest in that, patients are getting harmed right now, staff are getting harmed, and that's why everybody in the NHS, the workforce, is just fed up, because we are so sick and tired of seeing our patients come to harm, our colleagues come to harm. We have record levels of staff suicide and staff mental illness and burnout, worse than ever before. And so that's why I think we're seeing this wave of discontent, this wave of strike action throughout the NHS as well.
Yeah, so tell me about that. So obviously there's striking over pay and conditions, but it feels like it's also a fight for the future of the NHS, because, as you say, doctors like you are on the front line of this. You're seeing the impact. You've seen how the cuts of the past 13 years in particular have impacted the situation. You've seen the impact of the 2012 Act that brought in lots more private companies, lots more competition, and then the sort of rationing of our healthcare as well, and the 2022 Act, which kind of carved up the NHS into pieces. And of course, also the Secretary of State doesn't have a duty to provide care anymore. So
exactly, yeah. So that legally they're protected, yeah.
Yeah, but tell me, I mean, how does it feel for doctors and for healthcare staff in general? And what's your experience of people kind of on the picket lines with you and how they see it?
So, I had written a piece just before the pandemic actually started, in the Guardian. This was maybe I don't know how long right before lockdown. Well, sorry, my cat is standing on my keyboard. It's okay. Just before the pandemic, I wrote a piece calling for NHS strikes, because the state of the system at that point, prior to COVID and the pandemic, was terrible. We were seeing record numbers of people come to harm because of the terrible delays in A&E. Ambulances that were queuing, 30 ambulances queuing outside of hospitals trying to offload their patients. But because of the terrible problems in funding and staff and beds and social care that this government has promised to fix but never did, the experience of that patient at home, they have a heart attack, they need to call an ambulance, the ambulance is delayed, then they get to hospital and they're waiting in a queue of 20 to 30 ambulances waiting to offload their patient into A&E. But A&Es are packed, and the waiting rooms are growing, and the hospital doesn't have any hospital beds because the government's cut them. And then we can't discharge people because of because they haven't funded social care. And so every stage of the process, the NHS is constipated by design, because the government just doesn't care about it. And so just seeing those horrors pre-pandemic is what spurred me to get more involved about this. And then everything just fell off during the pandemic. Any resilience that we had left, which we had already spent through the years running up to the pandemic, it caused collapse. And that's why, the other health systems didn't collapse in the same way that ours did during the pandemic. If you look at the French and German systems, the same thing didn't happen, because they had that built-in extra spare capacity to care for patients and deliver, high quality healthcare. And then through the pandemic, we saw and the waiting lists before the pandemic were, I think, 4.6, 4.7 million. They're pushing 5 million before the pandemic, and then it just exploded afterwards. And I find it shocking that the government of France, in the aftermath of the pandemic, or fairly in the middle of it rather, said to all of their foreign healthcare workers, immigrants in the country who worked, in healthcare during the pandemic, they said, we are going to give you French citizenship to thank you for your service to this country during the pandemic.
Right.
And here we've been hit with increasing numbers of. I'm an immigrant. I pay the all of the fees associated with my visas every time I have to renew them every year and change, and we've just been treated just terribly. And aside from my own experience as an immigrant, just look at the general workforce. We've seen doctors and nurses and other healthcare staff lose up to 35% of their pay, the value of their pay, in the last 15 years. And so they clapped for us. They said that they would have our back. They gave us PPE that we would be using for a couple of days, and then the hospital would send us a message saying we have to stop using that because they are, they were expired or they just didn't work. Which is, you can imagine you're on a COVID ward taking care of patients, and the mask and the eye protection that you have has just been recalled. Like, you can imagine that you're already dealing with the terror and the fear and the PTSD from the trauma from seeing so many people die and not being able to do much for them.
Yeah.
And then in the aftermath of that, for the government to have to force us to demonstrate our worth to society. Like, are you kidding me?
Yeah.
Like that I am having to do, interview after interview just to express this position that why the BMAs had to fight for, the nurses had to fight for, every healthcare workers had to fight to prove to this country that we are worth funding well. We're not asking for massive amounts of money. We're not asking to be paid what my colleagues in the States are being paid. I could go back to the United States and make 4 times as much working in A&E, but I don't want to, because you have to live there and you have to deal with health there. You have to deal with terrible gun violence and all these people that have no health insurance at all. And so I don't want to be heartbroken every time I go into work, where I see somebody and I can just bandage up their arm, but tell them I can't give them anything else. I can, treat them. I can't send them for secondary care. I can't do much more for that. I don't want that system. So I choose to live here. And it's an understanding that we are not going to be paid nearly as much as we are in another system, but we're not asking for a crazy amount of money here. To make healthcare workers, beg for their dinner and demonstrate their worth and have to argue for their worth in the aftermath of the greatest crisis this country has seen since World War II, I think is just it's disgusting.
Yeah.
It's wrong, and they should be ashamed if they actually felt shame. But this government absolutely doesn't. I think the British people, and that's why I think that that there was such anger among the health workforce. We tried to I think we tried to negotiate with the government beforehand, but they just refused to listen. And so we had to go on strike. We've had 7 rounds of strike action so far for the doctors, and that's just going to continue because I think this government sees us as a useful. I guess a useful tool in terms of telling the British public that they're the reasons why you can't have healthcare because we're militant. They call us militant, and in my book, the people who should be called militant are the policymakers, the people in government who intentionally underfunded and undermined the best healthcare system in the world.
Yeah.
10 years ago in order to drive more people into private healthcare. Those people are militant, not the people that are trying to deliver healthcare saying, I can't survive. We have food banks at NHS hospitals because NHS staff can't survive. That's wrong. I think the British people see that, and they know that, unless there are healthcare workers working in the system, then their care is just going to continue to get worse and worse and worse. And so I think the British people, thank you to everybody listening, because I think that you guys remember what we went through, and what the country had to go through during COVID, and you know that we did our absolute best to fight for you and to protect you and your family. And so I think that's why I'm confident that we are going to win this fight, and that's why I'm confident that we are maintaining extraordinary levels of public support, because they see that we are fighting for patients while this government's fighting for billionaires.
Yeah, and so many healthcare workers died on the front lines of that battle. Yeah. And now, so many of them are moving out of this country because they can get a much higher salary in other countries, and there's adverts for doctors, to go to Australia and New Zealand, and people, moving away from their family to be a doctor elsewhere because this country isn't offering them, is offering them a real terms pay decline.
Exactly.
And just in case anybody's sort of coming to this content new and not quite clear what we're talking about when we're talking about this underfunding. So the UK is spending 40 billion less a year than France on its healthcare system, 73 billion less a year than Germany.
Yeah, it's so much more for Germany. Yeah.
So we're not making this up. It's very clear that there's been a systematic underfunding of the NHS over many years, along with draining money out to the private sector. Because I know you're busy, Andrew, and we've got lots of good questions coming in. Let's switch to Q&A.
Sorry if I was talking for so long.
No, it's brilliant. It's absolutely wonderful to get your perspective. So Ron, who I think spent time in America, says, 40 years ago, I ran up a debt of $18,000 because I lacked private healthcare insurance. I can testify to dire consequences from not having health insurance while living in the US. Scary stuff, yes. And Stuart says, why do politicians on both sides want to use private contractors in healthcare when it's more expensive and less efficient? And just before I come to you on that, Andrew, I think part of the answer is around the lobbying, the intensive lobbying that some of these US healthcare companies in particular have been doing. And so the problem is that as we go further down this track and they manage to get more embedded in the system, that danger increases. But tell me your thoughts.
Well, I mean, I think it's just that's a huge part of it is this lobbying and where it comes from. And I think that they see in the aftermath of, and this is certainly true in the aftermath of Brexit, when the economy is not doing well. I think they are looking for ways to bring in foreign capital to try to, try to see, which aspects of the economy they can grow. And the NHS is something that private healthcare has wanted to get their hands on for a very, very long time. And so, yes, it is more efficient and it is less expensive for us to do this through the public healthcare system, but those people can't make money off of it. And it's a long-term thing. And this is very funny. If you look at the ads from the Conservative Party right now, a lot of it is, long-term planning that we believe, and they're accusing Keir Starmer of being in labor of the short-termism. That is exactly what they have been doing for the last decade, last 13 years. They have not put in, they came up with a workforce plan at the very last minute, that takes 13 years, takes 15 years to implement. If they had done that when they came into power, when we were screaming about it before, then we wouldn't have the same workforce problem that we have right now. But it's short-term planning. It is greed. It is where they get their funding from. You look at a large number of politicians on both sides who will take political donations from private healthcare either directly or from people connected to private healthcare. So there's so much money, and they're getting a bargain. I mean, was it like £15,000 that is something like that Wes Streeting had accepted, something along those lines, and I don't know exact source, but that it was connected through, I think, through the Every Doctor research that I've seen. Yeah. That they're paying that amount of money to these politicians, and what are they getting in return? They're getting significant support for an industry that is booming right now, and that comes at the expense of the taxpayer, comes at the expense of patients and clinicians, and it's just it is short-term planning. It is the influence of lobbyists. It's and it is people that are just greedy.
Yeah, and it was interesting to see that in the Labour Party conference this week, there were fringes that were co-hosted or sponsored by KPMG, PwC, Specsavers, and you look at that and you think, wow, we're really up against it here, because these people do not represent the vast majority of voters in the UK, but they are right in there at the fringes, giving their perspective. And so Harry says, how do we counter the narrative that the private sector can be helpful to deal with NHS waiting lists? And I want to quickly come back on that. Check out our Only the NHS campaign, Harry. We're saying it's really, when we're talking about the crisis, because you're right, that's a really crucial question. We have to show that the NHS is the answer. And so we say repeatedly, only the NHS trains doctors and nurses. Those same doctors work in the private sector. So the private sector is draining the NHS effectively. Only the NHS provides A&E. The private sector doesn't have any A&Es. And only the NHS will deal with complex cases. So if you get some kind of fairly straightforward, simple, profitable operation done in the private sector and something goes wrong, you're often going to be heading right back to an NHS hospital to sort out the mess. And often, as Andrew mentioned, there's things that the private sector just doesn't want to, just washes its hands of. So I think that's one way that's a message we want to get out there in the lead up to the next election. Only the NHS. The NHS is the way forward.
Yeah, and that's brilliant. And you're spot on about all of those things, all those policies, and all those reasons. One thing that I cannot understand is, you mentioned A&E. Private hospitals don't run. There's no, if a rich person in this country, and this is going to, I think, part of the messaging over the next year that I'm going to be pushing more. If you are a wealthy person in this country and you have a heart attack, there's no special private ambulance that's going to come and pick you up. That's going to take you to some private, magical hospital. It's going to sort you out. That's going to put a stent in your heart. That's going to revive you. That's going to do, to do everything necessary to keep you alive and make sure that you have a good quality of life at the end of that. There's no private healthcare service, private provision that's going to do that. You have to fund the NHS, because an NHS ambulance, when properly funded, will reach you in 8 minutes. Will reach you in less than that. We'll have highly experienced people, highly trained people will take care of you from your door into intensive care, into surgery, to make sure that they save your life. And that is the only way to fix that. So that's why I just don't understand. To wealthy people listening, we're not asking for much here. We're asking for people with the broadest shoulders to pay just a little bit more in their taxes, and on top of that, for a government to actually care about the public purse and care about how they spend our tax money, which we all should care about. But we're asking for just a little bit more in order to make sure that we all get the care that we desperately need, including you. And so that is my message to wealthy people in this country, that we're not trying to bankrupt them. They're still going to be obscenely wealthy, have a wonderful quality of life, but we're asking for just a little bit more because we need to balance this better, because right now everybody is suffering from underfunding, from under-resourcing, and from a government that has no interest in fixing this problem for anybody.
Yeah. And the polling shows that people are willing to pay a little bit extra, actually, and that's across the board. Although, as you say, lots of money being wasted on privatisation as well.
Huge amounts. Yeah.
Andrew, we're having a great conversation. I hate to break it up, but we said we wouldn't keep you longer than this. So I'm just gonna highlight a couple more things, but then we'll wrap up. Margaret says, yes, Andrew, it will be very hard to get our NHS back, but we must and will fight for it. And Matthew says, given our system was world leading a decade ago, what steps do we need to take to get back to that quality of care? So I'm going to move us on, if you don't mind. We could go on for a long time with this.
Really quick, funding, beds, staff, and social care. Every politician should be answering that question. What are they doing to fix funding, beds, staff, and social care? Those things, and an end to privatization, because it is a waste of our resources. Those are the things that we need to focus on, and trust We Own It and the SOS NHS Coalition, because we are fighting for you guys. Thank you so much for having me. Sorry we had to rush that.
So action of the week is support the strikes. And Andrew, just quickly, where can people find out about supporting the strikes and joining the picket lines?
Well, I don't know if the next iteration of our strikes have been announced yet, but if you go to bma.org, you follow BMA on Twitter. We put it out a lot. I'm sure that you guys will as well. Just be on the lookout, and you'll hear about it.
Yeah, and also check out NHS Workers Say No, as well as SOS NHS and Keep Our NHS Public. Our action of the week also, we've got a few for you this week. Write to Keir Starmer following up on the action that you saw at the start of this video. Drop him an email, say that you want the NHS reinstated as a fully public service, as it should be, as it was intended. And follow Dr. Meyerson on Twitter. Andrew is also always doing fantastic tweets, telling us what's at stake here and really powerfully communicating that message. So do get that message out.
Thank you so much.
Thank you for being here. Thank you so much, Andrew, for joining us.
It was my pleasure. Anything for the NHS. Thanks for having me.
It's absolutely fantastic talking to you. Thanks to all of you for joining us. Please do subscribe, like this video, comment below the video so that more people see it. And we will see you next week on Thursday at 5 p.m. Thanks, everyone.